What we're
Good
going to be talking about today is A to B and essentially why, how it benefits home health agencies. There's sometimes a lot of confusion on the transition process from Part A to Part B and who it affects, who benefits from it. So I kind of want to tackle on it from typically people don't think about it from the agency perspective and their benefits, their perks, their not kickbacks, but the way they get rewarded from having a good Part B agency that they trust. So let's just kind of dive into this topic first and foremost. But what is one thing kind of right off the bat that you'd say most people didn't know that how Part A could benefit from Part B?
I'd say the biggest thing of all that we hear as feedback from the agencies and that, we try to present and you should try to present if talking to a Part A agency is if the patient goes back to the hospital while they're not receiving Part A services, it will cost the agency money and it creates an opportunity where a different home health agency can capture that patient coming out of the hospital. So it's sort of a two-part benefit. The first one is they don't want rehospitalizations. They're very scared of that. So if you are providing services to the patient through Part B after they're discharged from Part A, the chance of rehospitalizations goes way down. Somebody in the house making sure the patient is continuing to exercise, walk, move, with safety instructions, and someone going there regularly to keep an eye on the patient to correct problems that are arising or catch an issue before it gets bad. If you're assessing vitals and discover there's something off, they can get back to the doctor and they might need their medication change. That could prevent a fall. If they're not drinking enough water and you're pushing that, that could keep them out of a variety of health issues from constipation to skin issues to, again, low blood pressure and falls. And UTIs can be prevented. All of these things keep patients from being rehospitalized, which will cost the agency money if they go back within a certain amount of time of being discharged from Part A. And then
Mhm.
also, it is not uncommon that a patient is seen by Part A, they go back to the hospital, and someone at the hospital they go to has a relationship with a different Part A agency and redirects that patient to a new agency for Part A. That also costs the agency money. If it's split between two agencies in a certain time period, they have to give money back. So this is something that is a real problem for Part A agencies with their patients. And when they realize you can prevent that from happening, either by preventing the hospitalization or preventing the patient from going somewhere else if they are hospitalized,
Mhm.
because as a therapist, you'll know the patient went to the hospital and you can let the agency know to keep track of the patient and make sure they come back to them. That's a massive help and a big money saver for the agent.
Yeah, I think a lot of therapists don't understand maybe the rules or the standards that agencies are held to by Medicare or how they're reimbursed. Because you wouldn't think, okay, patient gets hospitalized, the agency loses money. The way that agency reimbursement model works is they get a bundle of money up front from Medicare whenever that patient comes on service and the OASIS is performed. Then they're responsible for that pot. But if some rules get broken, meaning like if the patient gets discharged too early and they LUPA, the patient ends up with a hospitalization, you name it, Medicare takes back some of that money when that cuts their profits and it hurts their ability to perform services at the agency level. So don't therapists don't underscore how important it is to be that trusted person so that agency can have reliable eyes on the patient and trustworthy eyes on the patient after they have been discharged. And this, yeah, go ahead.
They do things in 60-day cycles. So they're responsible for that whole 60 days. And so when the patient starts, like you said, if they get discharged after 4 weeks, there's another 4 or 5 weeks. They need that patient to stay out of the hospital and do well. And then obviously there's no time frame on losing a patient to another agency, and they want to get the patient back. Forget about if they have to lose money in that 60-day cycle. Maybe 2, 3 months go by, but they still want the patient to come back to them and not go somewhere else. They consider it
Mm.
their patient, they want it. So if you're providing Part B services for the next 2 to 3 months with that patient, that entire time, if anything happens, you'll make sure that patient goes back to the Part A company So you're sort of a safety net to capture their patients back if anything happens for a long time.
How would you recommend a therapist first approach an agency or who to talk to at an agency about the ability to offer Part B services to their patients?
Obviously, if you're working for that agency, starting with the person you know best or are most comfortable, you can share that you want to do this, and they'll probably direct you to the director of nursing or clinical services to have that conversation. And I would just be upfront and honest about what you're looking to do, but how it can help the agency. And we've given two reasons already. It could be a way to prevent rehospitalization, which will be music to their ears. It can be a way to recapture patients that go to the hospital and that you'll keep the agency aware when this happens. Otherwise, they'd have no way to know.
Mhm.
But I also think you can reinforce that you will redirect the patient back to Part A should they need it. Not every patient has to go to the hospital to be appropriate or need Part A again. And it could even be after 2, 3 months of doing Part B services, you don't wanna use up all of their Part B money, and the patient is still homebound in many ways, and it would be appropriate to go back to Part A. So you can help the agency capture patients back that they might not normally have, and to, keep that flow going for that patient and keep it with the agency. And these are
Mhm.
all things that I think agencies would find attractive and helpful. And you can also push to the agency, it's a continuity of care for the patient themselves, that the patient can have the same therapist throughout. You'll redirect them to A, they'll go to B, same therapist the whole time. It makes the agency look good that
Yeah.
they have the same therapist taking care of their patients and providing the service. And it's just healthy for the patient to
Mhm.
be able to continue with the therapist they know and like.
Yeah.
So there's a lot of benefits to the agency and to the patients, which should matter to them.
Yeah, anytime you're approaching conversations, you want to give first and provide value first. So when you have that conversation with the agency, go in there armed with ways that you can help the agency. Not that, hey, I want to, transition patient Part A to Part B. Say, hey, you thought about this. Typically after a patient's discharge, the agency has no eyes on that patient. Think about standard. They discharge them. They either continue with their home exercise plan or they typically go to an outpatient clinic where the agency has no eyes on them anymore. You go in there and say, hey, I could be a trusted provider to be able to continue with that patient to one, minimize hospitalizations, two, keep eyes on the patient. So if they did get rehospitalized, we can get them back. Three, help lower the chance for anything bad to happen to that patient post discharge. Armed with those three things, even more of the stuff we talk about, you start putting that up in their mind of, oh, this is actually a great idea for my patients, our patients. That way they can get that care they need. Everyone's happy and it's a win-win situation all around. And everything always has to be win-win when you're dealing with other businesses. It's got to be beneficial for both. And leading those conversations, starting like that, is only bound for good things.
Yeah, there are even scenarios we didn't talk about where if you're in there, it helps. Many patients have multiple doctors. And sometimes the doctor that sent the patient to the agency, let's say it's the internist, is not the one they're dealing with for a new problem. Maybe they have a cardiologist they're seeing. That cardiologist might have a relationship with a different home care company than the one you work for that patient. And if
Hmm.
you're for Part B and the cardiologist decides that they want to send out Part A with a different agency, you can catch it in time and redirect them to the agency they had before. They don't have access to somebody doing that if we're not providing Part B. Also,
Hmm.
there's going to be other providers of Part B. I would think the agency would want it to be the one that works for them providing the Part B service, not allow the patient to go somewhere else. Even a traditional outpatient office that's taking care of the patient could again lead them back to a different home care agency. So I would just be playing up that you're loyal to this Part A agency and you want to keep these patients coming back to them because you want to work with that agency and you know that they'll allow you to do Part B. It's very
Hmm.
biotic. It's very mutually beneficial for everyone involved. And again, don't underestimate the value to giving a patient good services and continuity and letting the agency know that's one of your intentions as well. It's not about you getting more visits, it's about taking care of patients. I think that sounds good.
How do you recommend those therapists keep an ongoing communication with those agencies, when they are seeing patients on Part B, having transitioned tons of patients, in your career? how do you kind of keep that line of communication open to make sure there's always transparency and those things?
I think if you can be talking to the agencies about your Part B patients that were Part A, even if you're not transitioning them back, it could be beneficial. If you let them know that there's an upcoming procedure coming, if you let them know that they're traveling out of the area or they're moving back north because they're snowbirds, just
Hmm.
showing them that you're keeping them up to date and providing information, I think is a good way to do it. But the real communication that's most vital is just being on top of when they go to the hospital.
Right.
Or the first time you bring a patient back to the agency to see the value, whether it's through hospitalization information, whether it's you letting them know that they've had some med changes and they're not doing well with them, or they need nursing to oversee it. Anything where you can show them, I told you I was going to bring patients back. Here we are. Will be evidence to them of the value.
I like it. Let's wrap it up there. Thanks for the conversation. You guys, hopefully, you guys have already armed and go to be able to talk to agencies about your Part B services and really just have that honest conversation about how it benefits them, how you could be their trusted provider, and you'll start getting more referrals.
Have a great day.
You too. Thanks.